Welcome back to Links 24 and welcome to Whitney's Health Check, sponsored by Toma Memorial Hospital. I'm Whitney Sanjari, and this month I'm joined by Toma Memorial Hospital registered dietitian Joan Kortbein, who is here to help us cover the good, the bad, and the ugly of fat. Which ones are okay to eat and which ones you should be limiting in your diet. Welcome, Joan, to Whitney's Health Check.
Thank you for having me.
Thanks for joining here. All right, so Joan, you are the registered dietitian at the hospital. What's one of the services that you can offer the public?
So I see inpatients in the hospital that are there for health reasons, and then I also see outpatients. So if your doctor has an order for you or a referral for you to come over and see me, I can see people for weight loss, for heart disease, diabetes. I specialize in diabetes education. So any concerns that they have with their diet or just general instruction because they're confused about what to eat. Okay,
so they could get a referral from their doctor and then voila, make an appointment with you, and there we go.
Yeah, absolutely.
Okay, wonderful. So, Joan, we were talking today about fat, which tends to get a bad rap, right? Because most people are like, I have too much fat, I want to get rid of it. So let's talk about which fats are the ones that you would recommend eating in our diets.
All right, so the good, the bad, and the ugly, like you talked about.
Okay.
So let's start with the ugly.
Okay.
So let's start at this end and we'll work our way down. So right now, the Heart Association says that your trans fat, also known as hydrogenated fat, is your worst fat. That's the kind that we know increase our bad cholesterol. I always tell patients that's your LDL. Think of L as lousy, and then you remember which is which.
Lousy cholesterol,
That's
right?
right.
LDL, right? That's a clever trick.
So it's like Crisco shortening or any kind of shortening or stick margarines. So you start with a liquid oil. It's a process of adding hydrogen to it that hardens it. So that's that hydrogenation that you read on labels. So the hydrogenation is the process. The fat they create is trans fat. But right now we think that's the worst kind for us. So you want to try to avoid that as much as possible on labels.
So with trans fat, I've noticed sometimes you can look on labels and there might even say like, oh, 1 gram of trans fat. But sometimes it says 0 grams of trans fat. But then I look at the label and it says something like partially hydrogenated soybean oil or whatever oil or fully hydrogenated oil. Does that mean that when I look on a label and I see 0 grams trans fat in the label and then it tells me in the ingredients list that it says hydrogenated or partially hydrogenated, does that mean that that has trans fat in it?
Yes, it does. Manufacturers can still say it has 0 grams if it has less than ½ gram per serving. So it's a little misleading, so it's always good to read the ingredients because you're probably getting trace amounts from several foods you're eating.
Okay, and 0 is the recommended amount of trans fat.
0 is recommended, yes.
So having 0.5 in a serving would not be good.
Right.
Okay.
So then the bad of the fats are your saturated fats. Again, they raise your LDL cholesterol, increase your risk for heart disease. Years ago, we always thought it was about limiting fat. Now we know it's about what kind of fat are you eating. And so that's why we're looking at limiting saturated fat and the trans fats. So saturated fats would be in your full-fat dairy products, some of your meats, and then like coconut oil and obviously butter. So a good recommended limit for most people a day is about 13 grams or less.
So now I hear a lot about coconut oil and I see a lot about coconut oil.
I know.
So it might have some other uses besides dietary. But when we look at the label of coconut oil, because you said we're supposed to limit the saturated fat, if I look here, that has 14 grams in a tablespoon serving, and of that 14, 12 of it is saturated. So 12 of the grams of this type of fat are the type of fat that I really want to limit in my diet. Not that I couldn't eat it, but just in moderation.
Right. Controlled trials that the Heart Association has done and research has shown that coconut oil raises your LDL cholesterol just as much as other saturated fats. So it's not that, like you said, it's not that you can't have it, you just need to be careful.
Yeah, because I also see something I love here.
I'm a farm girl.
This is a dairy state, Joan. All right, so butter, something to just limit.
Yes, 1 to 2 teaspoons a day. 1 to 2 teaspoons a meal. Of added fats.
Of added fats that could be saturated or unsaturated.
Yes. So this is the good. So again, controlled trials have shown that if you replace these fats with these fats, you can reduce your heart disease risk by 30%. That's significant.
Good odds.
Yes. Yes. So avocados, awesome for you. Nuts, obviously, we say about 1/3 of a cup a day. And then olive oil,
which is like a handful.
Oils. Yes.
So if I were
it's about 20 almonds. Yeah.
20 almonds. Yeah, if I'm being good.
So keep in mind that if your goal is to manage your weight, which most of us are trying to do, all fats have the same amount of calories. They may do different things for our heart, but they're all the same in calories.
Okay.
But these are extra good for our heart because they increase our HDL cholesterol. That's our good cholesterol, and I say H is for healthy, so that you remember in your profile which is which.
So we're looking for the quick and dirty here is liquid fats at room temperature would be the ones that you'd want to stick to, or things like avocados.
Yep.
And these are the ones, solid fats at room temperature, you'd want to limit.
Yep. Soft tub margarines are probably your best spreadable fat. If you're not a margarine person, then butter, and then really limiting, trying to avoid the Crisco.
Okay. All right. Well, wonderful. Thank you very much for this, Joan. All right. Well, don't forget that you can find this and past editions of Whitney's Health Check on the Links 24 Facebook page. We need to take a short break, but when we come back, April and Cody are getting you back to school, ready with some study tips for the older students in your household. Don't go anywhere.